Welcome back to the front page for Your Eye on Health with Dr. Sudip Bose from Medical Center Hospital.
Hey.
Now, Doc, today we got a question from one of our viewers about nosebleeds and how to stop them and how to prevent them. They can be kind of scary for people when you're, in the middle of the grocery store and all of a sudden it starts coming. What happens with a nosebleed? What is it?
Well, we're approaching winter right now, so it's a great topic.
Yeah.
In winter,
cold.
things dry out, the lining of our nose dries out, and the blood vessels on the surface can start to bleed.
Okay.
So let's look at this. So you got a sponge, okay? So when the sponge is moist, it's one way,
right.
But when it's dry, you can actually flake pieces of it off.
Right.
And that's essentially what's happening when the inside lining of your nose dries up.
Okay.
It's kind of flaking off the external surface, you get some bleeding. And yeah, give me the top 5 reasons for nosebleed. Getting
punched in the nose.
Actually, I got 5 good reasons for you right here, okay?
Okay.
Don't pick your nose. That's the top.
Darn.
This is the top 10 causes right here for nosebleed.
Okay.
People pick their nose. That's the #1 reason. So
right.
Don't pick your nose. Try not to get punched in the face either.
Well,
that's a good advice. Don't blow your nose too much. Especially people who have allergies, they tend to blow their noses because they feel stuffed up, but that's because of congestion. It's not because of a lot of mucus in there necessarily.
Interesting.
So,
okay.
So don't do that. And the #1 thing I'd say is just don't freak out. I mean, people really get scared. You're bleeding a lot. You're not going to bleed out from a nosebleed. These aren't major blood vessels.
Right.
It seems that way because you're coughing and things like that, but just stay calm. It's going to be okay. It looks like a lot of blood. You're not going to bleed out.
Right. How about pinching the nose?
Pinching is important, how to properly pinch, because people pinch improperly. Like if I cut your arm right here, what would you do to stop the bleeding? Yeah.
Pressure on it.
You put pressure. Pressure is what stops bleeding.
Right.
So you put pressure on the cut. Would pressure over there work? No, you got to put it right over the cut. Right. So same thing with the nose. When you have the lining of your nose that's bleeding, you can't pinch the bone up here. That's not going to compress anything.
Okay, so people are walking around like this.
Yeah, they're pinching the bone, it's still bleeding.
Yeah.
So you want to pinch the soft part here. Pinch it, and then you got to stop the bleeding. So lean forward.
Forward.
Yeah, forward. So
most people lean back for stopping the bleeding, but that's not
Yeah,
happening.
so you pinch it and you lean back, it's going to keep flowing down your mouth.
Right.
So if you lean forward, you have stop a forward flow, and you've stopped the bleeding from the pinching the soft part of your nose.
All right.
And then other things, we talked about the dryness with the sponge. You can get a humidifier. You can take a little bit of Vaseline, put it on the, if you're prone to nosebleeds, put it on the surface of your nose. Keep away from the top 10 causes.
Right.
And if you're one of those patients out there who take aspirin or you're on a blood thinner, you may bleed a little more. Again, they're not life-threatening usually, but it's just you may need to seek medical care. But the initial steps are the same. You pinch it off, and that usually does the trick.
All right, Doc, thanks so much. And great questions we're getting submitted from our viewers. So if you have any questions at home you would like answered here on the front page, submit them to the email you see there at the bottom of your screen. We'll make sure they have the doc.
Please submit to either one of us
on our Facebook pages or on that email, and we'll make sure to get your question answered here on Wednesdays. Doc, thanks so much.
All right, thanks for listening.
We'll be right back. Stay with us.